Hello guys, welcome back to my YouTube channel. So today I'm going to share with you about the basic principles on the use of drugs under pharmacology. So before I get into the major details, I'm just going to define what pharmacology means for those maybe who forgot or for those who don't know. So pharmacology is a branch of medicine or even a branch of pharmacokinetics that deals with the action, the study of action of drug or the medication on the physiological system of an individual or a human being. So on what I prepared for you today, I prepared for you today the three principles uses of drugs. We only have the three principal uses of drugs. So number one, drugs are used in the cure of a disease. Drugs are used in the suppression of a disease, and drugs are used in the prevention of a disease. So number one, under the cure of a disease, what does this imply? This implies that there is application of a primary therapy in the treatment of bacterial infection, the viral infection, the protozoal infection, and even the fungal infections. And once this treatment has been administered and the infection has been controlled, the medication is withdrawn from the system. Yeah. So basically, we have examples of actually the drugs used in the cure of a disease, and they basically are the bacterial drugs used in the control of bacterial infections. Number two, we have the suppression of a disease. What does this imply? This implies that there is a control of symptoms of that disease, but the health of that individual is not interfered with, and it is maintained. So we have examples here. We have the drugs used in the control of bronchial asthma, the symptoms of bronchial asthma, such as salbutamol. We have also aminophylline, we have phenytoin and terbutaline. All can be sprays. All can also be sprays. Another one, we have drugs used in the control of symptoms of diabetes. In the case of diabetic mellitus, we can use metformin tablets, we can use glibenclamide, and even tolbutamide tablets. Another one, we have drugs used in the control of the hypertension symptoms. So here we have atenolol, we have propanolol, we have nifedipine, we have amlodipine drugs. And also lastly, under the suppression of a disease, we can have drugs used in the suppression of epilepsy in case of epileptic attack to individuals who actually have epilepsy. Examples of these drugs here, we have phenobarbital, the most known phenobarbital. We have sodium valproate, we have clonazepam, we have diazepam, which are actually one for the benzodiazepine drugs. So that is basically under the suppression of drugs. So the suppression of drugs also entails the control of symptoms such as the cough, whereby we give the codeine or dextromethorphans, and also in the control of pain during coughing. So pain can also, we can also give analgesics such as the painkillers. Examples here, we can have paracetamol, even the ibuprofens and analgesics. So lastly here, we have in the prevention of a disease. Under the prevention of a disease, this basically implies that the purpose of medication is basically to prevent the disease from getting into the person when the disease is actually not present in that individual. So example of these drugs here, we have the vaccination against diseases such as typhoid, vaccination against cholera, vaccination against tetanus, vaccination even against measles and TB. And all these are given under the national immunization in Kenya. We have a trivalent vaccines also given, that is the DPT, under the non-KEPI, that is the Kenya Expanded Immunization Program. Another one, under the prevention of a disease, we also have the drugs, the anti-malarial drugs given to those individuals visiting the malaria endemic zone. Examples here, we can have the minocycline, clindamycin, and also doxycycline. So that's why the three basically uses of drugs under pharmacology, and that is what I have for you. And before I end this one, I also wanted to remind you that drugs are basically poisons. We can recall from one of the clinical pharmacology pioneer, that is William Willdering, around 1789, who said that poisons in small doses are actually the best medicines. Yeah, but medicine in large doses are actually poisons, which was very true. Yeah, so that was what I have for you today. Until next time, I'm so grateful to you guys. Thank you, and please continue subscribing to this channel.